All right. So tonight we're super excited to welcome Dr. Alyssa Hickey and Dr. Meg Stavalone to talk to us from ANH Wellness to talk about chiropractic and pregnancy. So I would love for each of you to introduce yourselves, tell us a little bit about you, and then we'll let you take it away.
Perfect. I'm Dr. Hickey. I'm the owner of ANH Wellness. I've been practicing since November 2015. Um, and ANH has just slowly been growing, and I've been adding in so many wonderful and great providers. So we've been able to help a lot of pregnant mamas in our community. We treat the whole family, but all of our providers specialize in Webster technique. Meg and myself took additional training to get our CACCP, which is specific for pediatric care and treatment. So we help a lot of moms with breastfeeding, bottle feeding, and throughout the journey with their family.
Awesome. And then tell us a little bit about your family. You want to?
Sure, I have a little guy named Vincent. Mini Vinny. He just went up to bed with Big Vinny. He is 16 months old, and it's just the best thing ever. And I went to BBC for everything. I knew I was going to go their way before I got pregnant. And then once I got pregnant, I was like, sign me up for every class.
Yes. And you came to Breastfeeding Cafe and awesome. It was so
My
good.
favorite.
All right, Meg, want to introduce yourself too?
Yes. Hi. I'm Dr. Megan Stavalone, and like Dr. Hickey said, Webster Technique certified, pediatric certified chiropractor at ANH Wellness, and I've been in practice since December 2016, maybe. So it's been a while. Been doing this for a while. Uh, not getting any younger. I've trained as a birth doula and I've attended a couple births, and I have two boys of my own. Anthony's 3.5 and Carmine is almost 2,
Oh
but
my
he's
God.
not allowed to turn 2. He's not allowed. And yeah, with Carm, I went to the breastfeeding cafe when he was like 6 days old and was like, I'm gonna do this. And it was so wonderful and supportive, and the doula training was just the best. And we just have the best birth community here in Rochester.
Yes, and we love like sharing clients with you guys, and it really works. The collaboration works out so well. So, all right.
We're right up the street.
Yes, right. Yeah. Yeah, yeah. ANH Wellness is located like on Hellendale, which is right off of Empire, just like one exit up, or yeah, I think it's just one exit up, right? From Brown.
Yeah.
Mhm.
Yep.
Yeah. So not far from BBC at all. Okay, so
Mhm.
take it away.
Okay, let's see if I can do this because I am not tech savvy.
That's the woman with a podcast.
I know, but that's I can make a video, but if you want me to try and like share my screen and stuff, the chances of it
Oh
actually working,
gosh.
I just have bad. Let's see.
I don't even know how I would do it either. We'll figure it out.
We're gonna figure it out, and it's gonna be
Yeah.
great.
Oh, there you go.
Okay, now I just have to pull it up. Do you see it?
Yes, it looks beautiful.
Yay.
Yeah, Meg did most of it. So we're going to go through and talk to you guys today about chiropractic and pregnancy. Both Meg and I have our Webster certification and our CACCP. So that's what those additional initials are, and that's for the training for the pediatrics. Oh, and look at it works. um, and I also forgot that I also did the doula training, but I'm not a practicing doula, but I did do the training. It was nice that you added that in there, Meg.
Oh, well, yeah, of course. Am I only on your screen?
No, we
Because
see
I
you,
just
but
see my.
that's okay. Oh,
Oh, okay.
whoever's
Oh, I
Wait.
see what that is.
Oh,
Okay.
now I messed it up. Do you want me to remove you? Is it just having your
Oh, no,
face
it
on
doesn't
there?
matter. I just didn't know if that was me or if it was. No, that's fine because I didn't want my face to get in the way of any information that
I
we
can
have
move
on
you
there.
around. Look at this.
That's perfect. That's fine. Just throw me in the corner.
Our training is through the ICPA, so that's what the little symbol is there, International Chiropractic Pediatric Association. So if you have any family members or friends not in this area that are looking for a Webster certified chiropractor, that's the website that they can go to. All of the doctors at our office are certified in the Webster technique, like we said. We also trained in the spinning babies when they visited, and we have years of experience treating pregnant women. And Dr. Meg also trained in the VBAC support in infant feeding. And Meg, are you a part of the VBAC link?
Yeah, I did the VBAC Link doula training last year.
Yeah.
Yeah, it's
And
great. Mm.
so we've had, like we said, both, I mean, I guess that's 9 and 8 years almost of
Mhm.
experience. And then our two other providers, we train with them, and they've also done the Webster technique, and they sit in, and we all work really well with each other and kind of teach each other and learn off each other as well. This is Dr. Meg doing spinning babies on me, actually. I don't know if I was pregnant here though.
No, this was like a couple weeks ago when we did the we made like a worksheet
Well, that
and
shows how
you
much
wanted to
my
be the
brain's
model,
working.
so no, it's fine.
Oh no, where am I going to put you? Here we go.
Anywhere.
The Webster technique is a pregnancy specific chiropractic technique, and it focuses on pelvic balance. It relieves tension in specific structures known to cause pain and discomfort throughout pregnancy. It does require additional training, and it's safe to do throughout any point of pregnancy. I just like to harp on the fact that it's really important if you are pregnant and you are seeing a chiropractor that you're seeing someone who is Webster certified, and also someone who is actually going through and practicing the full Webster technique, because there's a lot of different ligaments and structures that you want your provider to work on that sometimes can be uncomfortable. Say if it was a male provider, like your sacrotuberous ligament, stuff like that. So sometimes they won't actually work on those areas just because it can be uncomfortable, but it really is important to have the whole Webster technique done. So Dr. Meg and I will go through and show you what it looks like as we do our presentation so that you can also kind of see. And we also tell a lot of our patients too, if you have been seeing the same chiropractor for years, and so you're like, oh, well, he said he could treat me while he was pregnant. You're welcome to come to our office, get treated while you're pregnant, and then go back to them. It's just really important for you to make sure that you're being treated by someone who really is doing the Webster technique. Like we said, it's focusing on certain muscles and ligaments that are known to get tight throughout pregnancy. And our goal overall is just to help balance that pelvic alignment so that baby can get in the best possible position. This is going to help reduce tension on any specific areas, not only so that you feel more comfortable, but then baby can move where they need to, which can help decrease labor times, help postpartum healing, and we'll kind of get a little bit more into all of that. So some of the important structures that we're going to go over is the sacrum, which is the triangle bone at the base of your spine, your piriformis muscle that attaches onto there. And a lot of times when that gets tight, you'll start to get that sciatic-like pain. Sacrotuberous ligament, like I mentioned. So we're going to get up under your tush on that sacrotuberous to help that release. And the importance of that, balancing that sacrum, is your sacrouteral ligaments are on the internal side of that. And if there's any torsion or tension, then that's going to affect the positioning of the uterus and put torsion and tension on the uterus. So our main goal is to go through and balance everything posterior, then flip you over, and we're going to loosen up those hip flexors. We're going to adjust your pubic bone and also loosen your round ligaments. I don't know if this little movie's going to work. I was hopeful.
Yeah, they were being weird.
They were being finicky. So if I push enter, it doesn't go.
But our social media is full of videos,
Yes.
full of
So
pregnancy
this is
adjustment
actually pulled
videos.
right off of our Instagram. I also have TikTok. I wish I could make it work though. Nope, not autoplay. We'll try one more time. Nope. I don't think it worked on like the furthered out, like before I presented it, I could get it to work. Let's see. We'll do it this way.
Oh, nice.
Maybe we'll do it this way. My gosh. It worked earlier. Oh, now it's giving this little error. All right, I'm sorry. Maybe Megs will work, but this video, I can also send it to you too. We have it's right on our Instagram, so you can go through, but it actually is showing me doing the full Webster technique, and I'm explaining it while I'm doing it so that you can kind of see what it looks like, and then you can see if you are receiving this and just kind of see what to expect. Because I think a lot of people get really nervous about going to the chiropractor, especially while pregnant, but it is completely safe. It's very gentle, and we can if some people don't like the cracking specifically, and we can actually go through and do the entire Webster technique without any cracking. We can go through and balance that pelvis and just loosen these muscles and ligaments and help you feel a lot more comfortable and also get baby in the best possible position. Another fun thing about chiropractic when you're pregnant, I always talk to parents when they come in, once we go through and balance the pelvis, you're going to feel baby move so much after the visit because it does really open up a lot of space for them. So that's like our fun little party trick. Here, Meg, you want to do this one?
Yeah. So I think kind of the obvious, like when you think chiropractic, like a lot of our patients are coming because they're in some sort of discomfort. So with the Webster technique, we're going to be, releasing tension in certain structures, which will hopefully improve your comfort and your mobility. With the optimal fetal positioning, we do have some patients that will come to us, and not that we are skilled in determining baby's position, but if they've seen their provider and they've been told that baby's breech or baby's transverse, we might do a little bit of extra work on like, those round ligaments that are in that lower uterus, or stretching those hip flexors, or giving patients like at-home care, whether it be like spinning babies, and all of that is just to help baby get into the best position. And then, yeah, there's a lot of really great information about chiropractic care decreasing labor times, just because, your body's going to be maybe more used to those type of changes that occur during labor and delivery. And, especially if we're giving you at home care, or, different stretches that you can do, these are all things that, we'll encourage our patients to try in labor. And we love when patients have doulas, because then they don't even have to remember. Usually their doula remembers, and everyone can kind of help them just get through it all.
Another important thing to keep in mind with chiropractic and pregnancy too is it does help balance the nervous system. So if you are someone who is high stress, you're stuck in that fight or flight, this really helps balance everything out so that you can get into that rest and digest, and that's where you need to be to get labor going, get in that safe labor zone. Benefits for postpartum care. Meg, do you want to go through this one too?
Yeah, so we will see patients, and we'll talk a little bit more about frequency of care later on, but we will see a lot of our pregnant patients postpartum. And unless you've had some sort of crazy complications, or maybe there's something that we might want to be aware of, a lot of our patients will come in pretty like soon postpartum, just because after delivery and nursing and caring for a baby, you might have some tension in the neck and upper back, or different things going on. And so we can kind of help our patients address those concerns and make you more comfortable. We co-manage a lot of our patients with local pelvic floor physical therapists. So, our patients are coming to us to be adjusted. And then the great thing about the pelvic floor physical therapist is that they can do internal work. So if our patients are having things that are maybe like outside of our scope of practice, then we can co-manage them with that. And then we will talk a little bit more about this when we get to pediatric care, but feeding support is a big part of our office. So it's kind of nice if we already, we have a relationship with you, and we meet baby, and we can kind of like guide you through the pregnancy, postpartum, feeding, it's just kind of like a nice flow of things. But we have patients that come to us, at all points. Like we have new patients that come that are postpartum. We have, babies that come for the first time. And so it's just a lot about patient education. And, we don't want our patients to be, in too much pain or struggling with nursing. So we just want to help in whatever way we can.
And it's a really nice thing for us too to be able to build that relationship. So we always enjoy moms coming in early on in pregnancy because there is so much information that you're learning throughout your pregnancy. But we also have those moms that come super late as well. A lot of times people will be referred to us from their OB or midwife if baby's breech, because the Webster technique is really great at helping to balance that pelvis so baby that can get in the best possible position, like we kind of mentioned earlier. But our visits are so much more than just like cracking or aligning the spine. There's a lot of patient education and sharing of really important information, especially as new moms. there's so many things that you just don't know about or you don't really have the time to talk to providers about. And we have a lot more time with our patients and we're able to build that relationship and see them continuously. So it's really great for us to be able to give you information in amounts that's easily consumable as well. And whether that's connecting you with other providers in the area or giving you like such simple little like mom tips just from 3 of our providers are moms. So
And if somebody's coming to see you postpartum, and not necessarily for baby, they can bring their baby with them, right?
yes,
Oh,
yep, our
always.
office is completely kid safe. It's fine for older kiddos, younger kiddos, grandma, grandpa. Our treatment rooms are pretty big, so you can bring as many people as you want. People have brought their doulas in with them, just so that their doula can kind of see what exactly is going on with that specific patient. And, you know, if we're like, hey, their right psoas has been tight this entire time, so that's something to pay attention to. Sorry, that's Vinny. That's something to pay attention to during birth, or, you know, this SPD has been like pubic bone has been giving us issues, stuff like that. The more the merrier. We'd love for you guys to come along and be able to learn more about what we're doing and what it looks like.
Awesome.
So Meg's videos are working, which is great. Meg, are both of these just the psoas?
So the one on the left is I think, okay, so usually with the second part of the Webster technique, we're having patients face up, and you can kind of
It looks
see.
like that's what they both are. So I'll go through and explain what it is.
Oh yeah.
Bye.
The
Night,
second
bye.
one is a little round ligament though, too. So you can
Okay.
kind of see like the way that we palpate like the belly and all that
And yeah,
stuff.
so I'll play them and then you guys can go. I'll kind of explain what's happening during them. The
Hmm.
video that I had went through the whole thing where you could kind of see a little bit more on the back. And I can always try and pull it up individually afterwards and share my screen and see if I can do it that way.
Hmm.
But this is so typically we start moms on our belly. Our table, as you can see right here, this part drops down and then we put a pregnancy pillow down so mom can lay comfortably. Then we flip her over and we're going to go through and work on the hip flexors. So Dr. Meg's doing a stretch right here that's on that psoas muscle. A lot of patients have really tight pelvic floors and really tight hip flexors, which then pushes the uterus up a lot higher and baby can't settle down into the pelvis. So going through and loosening this is not only going to bring balance to both sides, but also allows baby to drop in where they need to. A lot of times moms that have more of this tight psoas, what you'll notice, and I need to make another post on this because I did it a while ago and it was a really great visual, but those bellies are kind of like tipped forward more. So a lot of times once we go through and do the whole Webster technique, you actually look a little bit less pregnant afterwards just because it recenters everything and the belly gets kind of tucked back in and baby's sitting like down in the pelvis versus your hips rotating forward and your uterus like pulling forward more. And then the second one right here, Dr. Meg's going through and she's working on the round ligament in this area. Uh-oh, my cat.
I don't know if it was this video or not, but there was one where like this patient in particular, I feel like you could see her belly almost like go down a little bit.
Mm-hmm.
Because when I was like putting this together and watching, I was like, oh, I didn't notice that. Like, it's kind of cool.
Yeah, so the round ligaments are on the front and they're stabilizing the uterus in place. A lot of times, as you get tension in some areas, one will get tighter than the other, or if you get more of that anterior-pelvic tilt, then both will be tight and you'll get that like sharp shooting pain or that lightning crotch. So we like to go through and loosen that, and then we'll also adjust the pelvis while we're there. So our initial exam is about an hour. We'll go through and review your full medical history, reasons for the visit, goals of treatment, give you some exercises to do at home. We have a sheet of local providers and resources that is just really helpful throughout pregnancy and postpartum as well. Then our follow-ups are about 20 minutes. Patients, like I said, are able to lay face down comfortably with a pillow. We have lots of different things that we can do and adjust our tables to help you feel comfortable. And they can be modified for what feels best for that patient. And our office is very easy to schedule with. You can schedule online or you can call and make a visit. We have a text number as well. And we're all pretty accessible. So if you ever have questions or anything, we always encourage you to reach out. And then safety. Meg, you want to go through safety?
Sure. And I think that the best thing about our office is that care is so patient specific. Like, yes, the Webster technique is generally the same visit to visit, but we really like take our time to kind of know like what your preferences are as a patient. Like maybe you don't like a certain type of adjustment, or you don't like being in a certain position. So it just really kind of like, I don't know, improves like safety in our office. Not that we have anything to be worried about, but um just kind of doing it patient to patient. And then we ask a lot of questions on our intake forms about any pregnancy complications that you might have, or anything that you're being monitored for, or abnormal testing. And then towards the end, like we will always be asking, if, moms may be having some sort of preeclamptic symptoms or anything to be concerned, like we always encourage them to follow up with their provider. Um, and then, like I said, we'll, talk about any diagnosed conditions and determine anything where we wouldn't maybe want to be doing chiropractic, or we wouldn't feel comfortable doing certain movements. And like Dr. Hickey said before, we can do the whole Webster technique with no cracking. I mean, we certainly can do adjustments where you're getting the cracking. Some patients really like that, especially when it comes to tension in like the mid back or ribs or neck. But it's just such a gentle technique that it can be translated in so many different ways to make everybody comfortable.
Perfect, perfect.
Yeah.
Okay, when to start care. So we kind of had mentioned before that we really enjoy it if you come early on. Sometimes we're the very first people to know that someone is pregnant, even before some of the partners, which is pretty cool. But it's also totally fine for you to come in later on in your pregnancy. If you're past your due date, postpartum, at any point, we welcome you and we would love it. It's just, we prefer it because then we can build more of a relationship. We can get more of that patient education in as well. You can get adjusted at any point, and it's safe throughout every trimester, including the first. Usually we're seeing patients every 2 weeks, but that will also be dependent on the person themselves and what they might have going on. And then once you're in your third trimester, we typically like to see you once a week. If your baby is breech, we are going to see you more often. And oftentimes we're going to work pretty closely with some very talented acupuncturists that we have in our area as well. Like we said, we're very passionate about patient education, and we find that many patients benefit from ergonomic and lifestyle advice even early on in pregnancy. So a good thing to keep in mind too is that relaxin that you hear when you're pregnant, that hormone that increases, is actually increasing at the highest rate in that first trimester. So a lot of times, a lot of moms are in pain early on, and they're like, I don't know how I'm having this much pain. I'm only in my first trimester. I don't have a belly yet. No one knows that I'm pregnant, and my sciatic nerve is so angry. And that's so common. So we just want you to know that it's totally safe for you to get treated, and there's options out there for you so that you can be more comfortable. And then pediatric care. Something
Yay.
else that we're also very passionate about. Chiropractic and pediatrics is so amazing. I'm just going to start out by saying, no, we're not cracking your baby. A lot of times people are kind of unsure of what exactly we're doing and if we're doing anything, but then they'll see that the results of the symptoms that they were complaining about are so much better. And that can be with feeding support, reflux, colic, constipation, just like a lot of times these really fussy babies that, the pediatrician's like, oh, they'll grow out of it, and parents are suffering. Or, if the breastfeeding parent is having a lot of pain and discomfort while they're nursing, we're able to help a lot with biomechanics of baby's jaw and neck that might be contributing to them having a tight latch or favoring one breast over the other. And this is just an important thing to take into consideration, especially while you're pregnant, because I think you're so focused on the birth that a lot of times like the breastfeeding journey gets forgotten, and there is support out there, and it's a really difficult time. So it's really important to know the resources that you have in our community. A lot of times babies will sleep throughout their initial visit. Like we said, the whole family can come, brother, sister, they can come as well. We work very closely with local IBCLCs and other feeding professionals so that we can collaborate on care and make sure that you're getting the best care that you can, while also not stressing you out by having a billion different appointments while you're recently postpartum. And another thing with pediatrics is it's so cool to see too, because babies do respond pretty immediately, which is really nice. Um, but same thing, you want to find a provider that actually is trained in pediatric care, because there is additional training out there. It's not required. Any chiropractor can see anyone. But there's a lot of information there, and it's really important to make sure that you're seeing someone who has that education, so that not only they can help support you and properly care for baby and give you proper recommendations. And here's our beautiful little team. That's my mini guy when he was just tiny. Oh, there we go.
He
Meg,
was
I
so
scooted you
little.
out. He was so little. This is Dr. Ari, Dr. Abby, Dr. Meg, and myself. And then Erin works at our front desk. And this is Lil Minden. Like we said, we have social media. So Instagram, ANH Wellness. And we also have TikTok, which is just Dr. Alyssa Hickey. And then we also have our Adjusting Motherhood podcast that we started, and we share a lot of really great information on there. And we have some lovely guests like Allison. And then Jenny is on our one that's getting released on Wednesday. So this is another area where we can share a lot of really great information that we might not be able to get in your 20-minute visit. And then people can consume it at the rate that they would like to.
Awesome.
Yeah.
Thanks, guys. And, I'll just say that like we refer a lot of our clients, both like lactation clients and birth doula clients your way, in part because we hear such wonderful feedback like in the community from from our clients. Like we just, just to like plug that everybody loves coming to your office.
I love to hear that.
Aww.
Yes. Yeah.
That's the
We don't
best.
feel like we work. Like I feel like I don't feel like I work. Like I don't feel like it's a job. Like we just have so much fun and our patients are so great. And I think that with the four of us providers, like we all work so closely together and bounce ideas off each other and learn from each other that it's just the best. We have a lot of fun.
Yeah, it feels like true collaboration, and that's,
Mm.
I just love that. So awesome.
And we're very passionate about it. So a lot of times if someone comes in and they're asking questions and we might not know, we have a whole slew of other people that we can lean on to ask questions, and we will find someone who knows. And we work whatever you need, we try to offer it in the best way possible.
Mhm.
Does anybody have any questions for Dr. Stavalone or Dr. Hickey, or just about chiropractic in general?
Yeah, I was just wondering what the cost is associated with, like, do you accept insurance or is it just cash pay or how do you guys work?
Yeah, so we accept Blue Cross Blue Shield, and then we also have a cash rate. So our initial exam is the more expensive one since it is an hour, so it's 165, and then our follow-ups are 65. We also allow you to set up payment plans if necessary. We try to work with you so that it can obviously be achievable for you as well, and you can use your FSA and HSA.
Awesome. That's good to know you take Blue Cross and Blue Shield. So that's Excellus. Is that the same?
Yeah.
Mhm.
Yep. So we take Excellus. I don't know if it's better to say Excellus or Blue Cross Blue Shield,
Yeah.
but
Yeah.
yes.
I don't
No,
know
because I
either
get that
way.
question a lot, and so I'm glad to know that. Thank you.
Yeah.
Yeah, so if you have a plan and you have a copay, then we'll have a lot of patients that just pay their copay, which would be the same as I think if they're seeing any other specialist.
Cool.
And then if you have a high deductible plan, the money goes towards your deductible.
I'm gonna see because I have that one video. I'm gonna see if I can pull it up so that you guys can see that as well, and then I can share my screen again if you want to see it. If not, then
Yeah, I would say go for it.
yeah.
Good
Okay. It's downloading.
Okay.
I was just gonna say, you guys weren't around when I was pregnant because I'm old, but I did chiropractic with my chiropractor, who I don't see anymore, but I at the time and my entire pregnancy, I had a really great labor and delivery, no problems. Everything was wonderful, fast. And then when she was a new infant, like I think it was within the week, brought her in for an adjustment just because I wanted to make sure, you never know. She was perfectly in line. And then I brought her back not too much longer after that because she wouldn't poop.
Yeah.
And the chiropractor, oh, I can take care of that. And he just did some weird wiggly thing with his
Yep.
fingers on her lower back. I took her home and I just laid her on a diaper and she like pooped for like 10 minutes. I mean, it wasn't that
Yeah.
long, but it's what it felt like.
That's what it felt like. No, that constipation's like such a fun one because it's usually pretty instant. So we carry diapers and wipes in her office because a lot of times people come in and they're like, they're not gonna poop while I'm there. And then it's like a huge blowout and we have to like find a
It's like a
onesie
Play-Doh
for them.
machine.
Yeah.
Remember those Play-Doh machines?
And we, with patient education for that too, we teach parents a lot of different things. So like, okay, baby's doing this, like I'm showing you that you can do this thing at home that might help them feel better, or this specific hold because they're presenting in this way. And every baby's different, you know, if they have a preference one way, and then you find out like, okay, the changing table's there and the light is over here, so they always are looking this way, let's switch that up. You know, sometimes it's very simple tips like that that can make a world of difference of like, okay, now my baby doesn't have a flat spot anymore because we did minor changes to their nursery.
Well, I'm a believer, and I always
Dr.
tell
Abby
people
typed up a
that.
lot of, oh, sorry, go ahead.
I was just saying, I definitely talk about chiropractic in my classes, especially during the postpartum piece, how important that is for babies even, and you know, just for moms. But I think it's huge, and you guys are on the list.
Oh,
definitely.
Yeah, that first postpartum adjustment is like, I don't know. That's probably one of my favorite. I mean, I love adjusting patients always, but that first postpartum adjustment, and especially like the patients are finally like, "Oh my gosh, I can lay on my belly. This is great." Yeah, it just can be so, you know, in those first couple weeks postpartum when you're just in a fog and you know, maybe having that increased tension from nursing and feeding baby and carrying baby, it's still nice to do something for yourself.
Yeah.
And get adjusted.
I have a question. So, you know, with pregnancy, a lot of like it's kind of time sensitive for care, right? So say we're working with clients who like they're 36, 37 weeks, they've got a breech baby, they've never been to Cairo. What, like if we sent them to you, like realistically, how long would it take for you guys to get them in?
Pretty quickly. If
we
they
can
call,
do
we
it
can
quickly,
usually,
yeah.
because there's 4 providers. My schedule is a little bit more full, but among the other providers, typically we can find a spot that day that works well for their schedule and whatever the providers have open.
Yeah, and you can
Awesome.
message us like if I know some of you probably have our phone numbers. I mean, I don't
Yeah.
mind taking a text that says, "Hey, I've got a client, like what do you have?" Because then you know, we can talk amongst ourselves and like maybe even stay later or open up our lunch. Like that's never a
Yeah,
problem.
all of our
Okay.
providers are pretty great at if someone needs to get in, we'll make sure that they get in. Sometimes,
Yeah.
like I'm going in a couple hours early tomorrow to fit people in, or we stay later, like Dr. Meg said. And also just letting our front desk know. So if someone puts in a request for an appointment or to go on the wait list, you can leave like a note, or if they call and just say, I have a breech baby and I was told I needed to get treated, our front desk will let us know pretty quickly so that because they know that we need to get them in quicker
Beautiful.
too.
I love it.
Yeah.
Love it. Speaking from personal experience, I had a breech baby in Webster, but it was like a couple weeks to get in when not with you guys.
Which is so stressful.
But then I'm like, well, my baby's breech and I can't get into this thing that I'm supposed to be doing.
Yeah.
So that's really great to know.
Getting bigger by the minute here.
Yeah.
I see a lot
There's
of
not that much room for this baby to flip.
No more bagels.
I know, right?
I would say like
this is my bagel
so
baby.
many of our patients are probably already seeing like Patrick or Jackie too, for acupuncture. So we usually say, hey, see us both and let's just do this. Let's see what happens.
Cool. Thank you.
Yeah.
Awesome.
I have that video if you want me to do that. I can share again. Let's see screen. We're going to see if this works.
Okay. You know, if you're pregnant, you can still see a chiropractor. That's right. So come along with me while I show you what a pregnancy chiropractic visit would look like. I'm going to start by going through and loosening up all the tension that she's feeling throughout her glutes and her hips. We're going to release some tension in the sacrotuberous ligament and also go through and work on any tension that I feel in that piriformis. Our tables are hydraulic powered, so they pop up and they allow me to put gentle pressure downward on the sacrum where I'm noticing any misalignments. We want to go through and optimize pelvic alignment so the baby can get in the best possible position. This is not only helpful for baby, but it's going to help mom feel a lot more comfortable throughout her pregnancy. When you're pregnant, one of those hormones that increases is relaxin, that relaxes all of your joints. So we want to make sure that we're keeping everything nice and aligned. We're going to loosen up that thoracic spine. And those adjustments feel so great for any moms that are having really severe heartburn. I love to use the little massager to go through and loosen up any extra tension that we might be noticing. And I like to go through and massage mom's shoulders. There's a lot of changes that happen throughout our posture as our belly's starting to grow, and that upper neck tension can be really uncomfortable. Then we're going to loosen the hips by stretching out that psoas muscle. And I also want to go through and adjust the pubic bone, which is the bone on the front part of your pelvis. Tammy works here at our office, and I was noticing that she was having a lot more tension on the left side of her belly. So I went through and I just loosened up the round ligaments and stretched out that psoas muscle. If you want to find a chiropractor near you, go to icpaforkids.com and type in your zip code.
So could you guys hear what it was explaining while it was going? Okay.
Yep.
So it's so funny because Tammy's our massage therapist. And I went out and she was like restocking the shelves, and she doesn't mind me touching her belly, and I love touching a belly. So every time I walk by, I like touch it. And I was like, "Oh, your left side's tight. Do you have a second right now? I'll adjust you." My last person canceled, and she was like, "Of course." So she came in and we were able to go through and adjust everything.
Awesome. That's so cool.
And it really is pretty immediate. Like, it's a very cool thing to see. And, you know, if you do have a mom whose belly is like super tight on one side and you can kind of see, or if they have a heart-shaped uterus, stuff like that, going through and doing the Webster technique and just watching everything kind of relax and look more symmetrical, it's really, really, really cool.
Love it. Yeah, we love what you guys do so much. It really makes such a difference for so many. So awesome.
We love what we do.
Are there any other questions?
All right. Well, thank you guys for being here tonight, everybody, clients, and Meg and Alyssa too. I'm gonna put together like an email for everyone, and I'm gonna link like TikTok, Instagram, your website, the podcast, all the things, so people can find you in all the different ways.
Perfect.
Yeah, and I'll have this. I'll upload this video to YouTube. It'll be private, like as long as you have the link, and then so that
awesome
here tonight can watch it as well. So
thank you so much.
Mindy, is there a dance party going on at your house? Bedtime dance party? I'm coming over.
There is. My kids have one of those lights on and they are dancing with their AirPods in. It's always something.
I'm coming over.
Awesome.
Anytime. It's always crazy over here.
You're funny. All right. Thanks again, you guys, and wishing you all an awesome night. And those of you that are like near having babies, like good luck. So
yes, good luck. Reach out if you have any questions. You don't even have to come into our office. We still love answering questions.
Thanks, you guys. You're absolutely the best.
Oh, you're the best.
Thank you.
Thank you.
Ladies.
Bye.